Texas began a phased reopening of its economy on May 1st. Businesses, including restaurants and retail stores, were allowed to reopen at 25% capacity. On Monday, phase 2 allowed capacity expansion to 50% occupancy, along with the reopening of office buildings with restrictions. Tomorrow, bars across Texas will be allowed to welcome back customers at 25% capacity. Joining us now live to discuss COVID-19 in Texas and the reopening of our economy is Governor Greg Abbott. Thank you so much for being here.
My pleasure. Thank you so much.
Governor, as the economy has reopened, we have also watched the number of positive cases and deaths go up. How comfortable are you with the reopening of Texas, balancing public health and the economy?
Sure, very comfortable. First, let's talk about the numbers a second, and that is the numbers fluctuate. For example, the numbers are down today as far as the number of people testing positive. There are more than 100 fewer people in hospitals today. Deaths is at a low number, and in fact, Texas has one of the lowest death rates in the United States. However, the most important number that we look at is what is the positive test rate. What that means is the number of people who are tested who test positive. And that has been in a downward downtrend from mid-April all the way until today. And so if you just look at the numbers, they look very good for opening up. So what we need to do, we need to just continue doing what we have been doing, and that is to make sure we wear masks where possible, that we continue distancing practices, continue good hand hygiene practices. If we can do that, we can continue to slow the spread of the coronavirus while also opening up more businesses, allowing more people to get back to work.
And going back to testing, The Atlantic and the Texas Observer are reporting several states, including Texas, are combining viral testing and antibody testing when reporting its negative and positive results for COVID-19. Now, the Department of State Health Services says on May 19th, they stopped including antibody tests in those numbers. Governor, was the state combining the numbers of these two very different tests, or were counties doing this and then giving mixed numbers to the state, or both?
So the information that I have is for about a 10-day period or so, during which some antibody tests were coming in. Could have been a bit longer than that. There was the inability for the counties to separate that out as it was received by the State Department of State Health Services. However, just know this, and that is if you look at the numbers are these, and that is there was a differential of less than 0.5%. Here's some easy math, and that is according to the aggregate number of both the antibody test as well as the overall test, the positivity test rate on May the 19th was 4.29%. If you eliminate the antibody test from that, the positivity rate was 4.7%. So you can see it's about a half of a percentage point difference. My point is this. The reason why all these numbers are important is to see what the trends are in the state of Texas. The trends are exactly the same with or without the antibody test. What you can find on the DSHS site right now is the separate information. In the spirit of transparency, what DSHS wanted to do was to advise the public of both antibody tests as well as viral tests, so people get to see both, and you'll be able to get to see that ongoing downward trajectory and the positivity rate, which is one of the elements we need to look at. The other element that we need to look at is the hospitalization rates. And the fact of the matter is our hospitalization rate, percentage-wise, gets lower and lower every single day.
Now, I'm looking at that dashboard right now, and it says as of yesterday, there were more than 49,000 antibody tests done. Does the state have any plans to also provide the public with positive and negative results of antibody tests that are being done in its reporting?
Yeah. Yes. And so what the DSHS is working on is to get that information from the counties to make sure that that information is clear.
Now, bars. Let's talk about bars because they are set to reopen tomorrow at 25% capacity. Do you have any concerns with this in terms of people social distancing, considering alcohol tends to lower your inhibitions?
So we worked with bars and their associations extensively over the past week or two to make sure that appropriate standards would be in place. And what we have been able to observe is that, as you might imagine, in many restaurants, there are bars. And we've seen the way that restaurants have been able to successfully open while maintaining distance in their restaurants and in their bars in their restaurants. And what bars were seeking to achieve is just the same practice that restaurants were allowed to do. And so if bars are successful in replicating what restaurants were able to do, bars will be able to open in ways that do not spread COVID-19, and hopefully we'll be able to open in a way that will allow them to expand their opening the way that restaurants have been able to expand their opening all the way up to 50%.
Unfortunately, Governor, we are out of time, but thank you so much for sharing your time and your perspective with us tonight.
And my pleasure. Thank you.